How's it going, modern manual therapy viewers? Dr. E here, back with another MMT Q&A. And at one of my seminars recently, a therapist who mainly does manual therapy in the form of soft tissue work asked a pretty good question. After reviewing all my lectures, where I share multiple studies where demonstrating it takes thousands of pounds of force to deform fascia or to rupture shoulder ligaments after every other supporting structure was removed, he asked, well, what about speed? Does speed have any effect on how quickly or how easily tissue can deform or even rupture? And absolutely, that is a great question. I haven't reviewed those studies, but back to simple biomechanics, when you typically graph stress and strain, when you add speed as a variable, the stress strain curve sharply goes up with much less duration. So over a slower duration, if you're stretching something passively to failure, the curve is much less steep if time was on the x-axis. But if you do something quickly, like try to think about a six-pack holder where you slowly stretch it, it will eventually deform and eventually rupture with the same amount of force. If even if it's like a significant amount of force, it's going to take a while with that slow speed versus the quick speed. If you just try to tear it like that, again, assuming you can use the same amount of force, that stress strain curve would sharply increase, meaning it would take much less amount of time before tissue failure and deformation happens. Deformation first, then failure. So what does that have to do with scar tissue and breaking up fascial adhesions? I would say relatively nothing, unless you are in the habit of finding a very specific portion of scar tissue, which is probably not necessarily possible. You don't know what you're palpating. It could be tone. It might be scar tissue, but what I often describe to patients is scar tissue is like the most fibrous, kind of tough meat that would take if you had like a Ginsu knife or a Cutco knife, it would still be really difficult to cut. Again, surgeons say that they have difficulty cutting it out after even locating it. It takes 20-30 minutes of blood, sweat, and tears to actually do that. You're not going to go in there, locate it amongst all the other tissues and just try to like rip it out as fast as you can. That's not really practical unless you're basically just punching patients as fast as you can or using some sort of tissue isolator or maybe even probably percussor. It's still not going to do it because force is absorbed. It's distributed amongst all the other tissues, amongst skin, muscle, fascia, bone. Even if you were able to isolate it, you couldn't get in there and get your hands on it and pull it apart and or shear it quickly to get that rupture. So certainly it is possible to change tissues quickly with a certain magnitude of force and especially speed. What's that have to do with manual therapy? I guess if you're doing spinal manipulation, you're doing a high velocity, low amplitude thrust, there is a small chance if something was truly adhered, you might rupture it, especially if over time that tissue was being stretched and stretched and stretched and stretched, and it was just finally ready to go. But again, most rapid responses are most likely not mechanical. They are neurophysiologic, where you change the perception of stretch or change the perception of tone. And remember that tissue changes, tissue adapts with length, just like at hypertrophy, over time with repeated stress, and that doesn't happen rapidly. So I hope that answers your question. If you were thinking about that, it makes it more clear in terms of, is it possible to break up tissue? Yes, but probably not practically with the way that we do things with our hands or even tools. If you like this video, please subscribe. Check out Modern Manual Therapy on Facebook, Instagram, and YouTube. Subscribe to our email so you don't miss any of our awesome daily blog updates. Check out all our products, ISTM, BFR, full-on webinars, a BFR cert, and more. Tons of great ebooks like Chris Johnson's Guide to Treadmill Running Analysis on edgemobilitysystem.com. Check out Modern Manual Therapy Premium, almost 700 videos and counting. We review 2 research articles for you a month. plus post mini cases, all my clinical practice patterns you learned at Eclectic Approach seminars are on there. Thanks. Check out UpDoc Media, my podcasts, Therapy Insiders, and Untold Physio Stories. And you have a great day.